Hi everyone, I want to talk about all causes of kidney failure. This will take me through renal, renal, and post-renal causes. Okay, let's go. I'll start with mathematical expression to point to pre-renal or renal. That's what we call fractional excretion of sodium. So the mathematical calculation will involve the amount of sodium in urine multiplied by the creatinine in plasma over the sodium in plasma and the creatinine in urine multiplied by 100. If the value is less than 1%, that is pointing to pre-renal. If it is greater than 1 to 2%, it's pointing to renal. It might be indeterminate, and when it is indeterminate, it's going to be less in early obstruction and greater in obstruction with kidney damage. However, many things are to be considered before drawing conclusion based on these mathematical expressions. But I'm just making that now to let it be clear that that is a possibility. We can carry out a test using blood urea nitrogen ratio to serum creatinine. When the ratio of the urea to serum is 10 to 1, that is normal. Or sometimes it could be up to 15 to 1. But when it is greater than 20 to 1, that is pre-renal. First, pre-renal causes, meaning before the kidney, the problems that I'll be mentioning in the next few minutes are already in the system. Okay, this will be mainly through two mechanisms. Either we'll be dealing with generalized ischemia involving the renal system or a selective renal ischemia. Acute tubular necrosis will occur in the face of a severe ischemia. What are the pre-renal causes? Volume depletion from vomiting, diarrhea, bleeding, diuretics used, osmotic diuresis with glucose, that is in diabetic mellitus, insensible losses, diaphoresis, bronchs, crush injury, and skeletal fracture. Still on pre-renal could be hypotension from septic shock, hypovolemic shock, distributive shock, neurogenic shock, or cardiogenic shock. It could be edematous state like in heart failure, liver cirrhosis, hepatorenal failure. Also in bilateral renal artery stenosis or unilateral stenosis in a solitary kidney. The second one that I'll be considering will be renal causes. That is, the problem within the renal system itself, intrinsic factors causing renal failure. Acute tubular necrosis is a kind of continuation of pre-renal causes of renal failure, progressing inside the kidney itself, leading to the renal cause of renal failure. The reason is simple. Severe states of all causes of pre-renal failure will lead to acute tubular necrosis. In addition to that will be sepsis, surgery, heart failure, and hypotension. Still on renal causes, we can be dealing with autoimmune diseases leading to glomerulonephritis. Maybe having hemolytic uremic syndrome, thrombotic thrombocytopenic purpura, anticardiolipin antibody syndrome, severe preeclampsia, HELLP syndrome, and pyelonephritis. As a matter of fact, I have several presentations on severe preeclampsia, HELLP syndrome, and pyelonephritis. You can check my channel for them. Renal causes will include nephrotoxins. And here I have the list of some drugs and some certain situations like NSAIDs, non-steroidal anti-inflammatory drugs. They will decrease plasma flow, and that will be due to decreased prostaglandins. Prostaglandin is expected to regulate vasodilation at the glomerular level. They can also lead to acute interstitial nephritis, with interstitial cells infiltrating the interstitium of the kidney. So those are the two mechanisms through which non-steroidal anti-inflammatory drugs could cause renal failure. Also, aminoglycosides, vancomycin, particularly when combined with tazocine, and of course, tazocine is a combination of two medications already, piperacillin and tazobactam. Heme pigments, cisplatin, radiocontrast media, pentamidine, and foscarine. Still on nephrotoxins, it could be tenofovir or intravenous immunoglobulin, mannitol, synthetic cannabinoids, and etastarch. That is a good volume expander, but could be dangerous to the kidney under certain conditions like sepsis or a critically ill patient. Next will be third, and that will be about post-renal causes. In post-renal causes, all will be due to obstruction at different anatomical structures in the renal system. The first will be at the level of the kidney, caused by stones, cancer cells, or papillary blockage with slough. At the level of ureter, we can have stones, cancer cells, tumor from adjacent structures, fibrosis retroperitoneally, urinary tract infection, malforming stent, clots, trauma, and ectopia. At post-renal level involving the bladder, we can have transitional cell carcinoma of the bladder, blood clot, bladder dysfunction, posterior urethral valves, bladder neck obstruction, and at the level of urethra, you can have benign prostatic hyperplasia, or some call it benign prostatic hypertrophy. You can have prostatic carcinoma, nephrolithiasis, or strictures. In conclusion, after listening here right now, you can then review the acute kidney injury or chronic kidney disease or the end-stage renal disease. All the causes that are listed there will be applicable there. Wishing all the affected people well. Thank you. Remember to share and subscribe, and you're free to leave comments. I appreciate it.